Hi guys, welcome back to our YouTube channel. We'll be dealing with learning unit number 16 on eTutor. These slides are also on eTutor, so please access them. I'll be teaching you guys about pediatric dentistry, making use of Dr. Usti Hazen's slides. So I've decided to just switch up on our previous formats. I think it would be easier if I actually give you guys the lecture as you guys are following on the screen as I've done. So I hope that will help. So basically with pediatric dentistry, it is basically a branch or a specialty of dentistry that deals with our pediatric patients essentially. So these are kids starting from birth all the way to the eruption of our permanent second molars. So those are the patients that we'll be discussing in today's lesson. And then from there, we just expect you guys to know the types of instruments that are used in a pediatric setting or practice, the procedures that are mainly associated with pediatric patients, such as fissure sealants, the preventative measures such as interceptive orthodontics, as well as all the materials that will be involved concerning pediatric patients. We also then expect you guys to know the role of the dental assistant in pediatric practices, and this would basically more than anything involve you guys knowing very well the different age groups, what kind of behavior is associated with the different age groups, and how you as the dental assistant are expected to then manage these patients accordingly. So that's essentially what we'll be doing, as well as then highlighting special needs children, which are very common in pediatric patients or pediatric practices. So we'll also be expecting you guys to know how to manage those patients, know how to identify them, and then deal with them accordingly. Okay, so this would be the presentation, as I mentioned before, that we will be dealing with. Okay. So guys, basically the purpose of primary teeth, as you guys can see on the slide, is speech. So it basically helps, primary teeth help children to basically develop their speech, recognize sounds, and be able to then translate those sounds into an understandable language. The masticatory function, that is basically chewing. Aesthetics, obviously, so that they look presentable and everything is in the harmony that we expect. And then from there, keep space for permanent teeth. This is very important because the early removal of primary teeth actually can cause rotations of teeth in the oral cavity, and then as well cause crowding or even spacing issues as a result of the early removal of those teeth. And then one that wasn't mentioned in the slide as well is actually primary teeth actively assist with the jaws to actually develop. So as the patient then grows and they make use of their teeth in masticating, essentially, it helps then the patient develop their jaws, particularly the mandible. So basically, ladies and gentlemen, this slide talks about the waiting area in a pediatric practice. The waiting area in a pediatric practice, ladies and gentlemen, must be very open, must be bright, must be creative, must be quite friendly, have lots of toys, have lots of gizmos, you know, just to actually make the patient calm and forget why they're there in the first place, because dentists actually make kids quite anxious. So if the waiting area then is actually bright, colorful, and keeps the patient distracted, it actually assists in you guys getting the patient relaxed and more cooperative once they actually get into the dental chair. So this is just an example of a waiting area. Bright and colorful, as I had mentioned before. Other practices also make use of gadgets such as headphones or earphones, music, even having items such as fish tanks, just to, you know, spark the imagination of the kids and make them feel calm. Even our clothing, ladies and gentlemen, also contributes. That's why normally when you work or deal with pediatric patients, the dentist would then, for example, wear like colorful scrubs, because then white coats actually give a sense of being formal and actually increases their anxiety. So normally when we deal with our pediatric patients, we also then wear like colorful scrubs and clothing just to keep them less anxious and more cooperative in that sense. We're then going to discuss the different age groups or stages of development that we find in a pediatric practice. So first and foremost would then be our infants or toddlers. Here mainly we're trying to focus our attention on the mother in terms of getting the mother, or rather the parents or the guardians, to actually ensure that they are keeping up with the appropriate habits that will lead the child into actually having good dental habits. So basically this would involve prenatal guidance, as I had mentioned, talking to both parents or the guardians. This would then be the first dental visit. So normally we encourage that the first dental visit must be done within the first year after birth, essentially. So this will then involve daily plaque removal by the parents or the guardians. So making use of a very soft, very tiny brush in the patient's oral cavity. Normally at this stage, they either have gums or the primary teeth are about to erupt or have already erupted, because kids differ from one child to another. This would then also involve talking about and discussing dietary habits as well as feeding habits. So most importantly would be then preventing baby bottle tooth decay, because it is literally the most common caries incident that we find in all of our practices when it comes to pediatric dentistry. So this would basically involve informing and encouraging the parents basically to not make their children sleep with milk bottles. Rather, if the kids are still making use of baby bottles, to rather just have water in them, or sugar-free milk if it's available to them. But more than anything, bottles that have juices and milk are such a bad idea, because we find kids with early childhood caries, multiple teeth that need restorations, multiple teeth that require extractions. So this is very important. Another habit that you find with baby bottle feeders would then be mothers who try to get their babies to sleep making use of like rooibos. But the problem is rooibos is not the issue, it's that they add quite a lot of sugar into the drink. So that then becomes the issue. This will then also involve talking about snacks, encouraging also fruit and vegetables, also telling mommy and daddy to actually minimize the amount of fruits, because they actually contain quite a lot of sugar. Or if they actually consume fruits, to actually make the child drink water afterwards, just as a flushing away mechanism in the mouth, so that the sugar does not actually stick to the teeth and actually cause decay. This would then also involve talking about medication. This would require taking an extensive medical as well as dental history, but they wouldn't necessarily have it at this stage, because this would be essentially the first visit. And then as well, as discussing all the nutrients that baby needs to have, encouraging them to still go for their post-natal visits at their appropriate clinics and hospitals, and then essentially maintaining the gums or the primary teeth as they are. We would then also go for follow-up or make follow-up appointments once we are done with this particular stage. From there, ladies and gentlemen, we'll be discussing fissure sealants. So fissure sealants are literally the most common type of procedure that we would basically perform in a pediatric practice. So they are basically placed to protect newly erupted teeth and teeth where sealants are indicated. By indicated would be kids that we've identified as being a high caries risk, or even our patients with special needs, because obviously because of their mental capacity they cannot, or physical capabilities, they cannot adequately maintain their oral hygiene. So in such a patient you would definitely have to perform or provide fissure sealants. So essentially sealants protect deep pits and fissures of our primary molars, as well as the permanent premolars, but other dentists also place fissure sealants on like the first permanent molars as well, depending on the severity of the risk of the patient that is actually in the chair. So how fissure sealants work, as the slide mentions, pits and fissures are fosses and grooves that have failed to fuse during development at the embryological level, ladies and gentlemen. So essentially what happens is that bacteria accumulates in the narrow pits and fissures, normally after eating especially like high sugar foods or high carbohydrate foods. And then basically then even a single toothbrush bristle is then too large to enter and clean these pits and fissures, which is basically what we find in our our patients, then the sealant then would then act actually as a physical barrier between the tooth or the coronal aspect of the tooth as well as the bacteria that has accumulated in our patient's oral cavity. So dental sealants are then basically a non-invasive means of preserving tooth structure and at the same time preventing dental decay. By non-invasive, ladies and gentlemen, the slide is basically explaining that we don't actually drill or prep any cavities when we're actually placing fissure sealants. It's more about isolating the tooth, actually etching the tooth, and actually placing the sealant. So there isn't any need for local anesthetic, any form of injections or anything to that effect. So that's what we mean by a non-invasive dental procedure. So as you guys can read for yourself, this is just a picture that Dr. Oosthuizen put in you guys as slides. It's just showing you the type of debris that has actually entered into the tooth but cannot penetrate deeper than that into the tooth or pulpal or dentinal material, because a fissure sealant is actually there to prevent such damage from occurring. The next slide is just showing you guys what we had mentioned earlier on, that essentially a bristle cannot actually penetrate into those deep fissures as we would like or expect from a dental brush, hence the need for fissure sealants. So this slide is basically just a slide of a molar with a properly placed sealant. So there's the sealant material that we were basically talking about, guys. Fissure sealants, ladies and gentlemen, normally they take the shade of like composites, but there are fissure sealants that are actually not tooth colored. Sometimes they're like pink or blue. This is basically also used to encourage patients so that they can, one, see that dental treatment was actually performed on their teeth, and to actually, encourage them to actually take care of their oral hygiene. So it's not always the case that fissure sealants are tooth colored. So just take that into effect, and don't be shocked if you actually get to a practice that does not make use of this type of fissure sealants. But those are not quite common because they can be expensive as well. Indications for dental sealants are very important, ladies and gentlemen. NB. So you need to know instances or situations in which the dentist or the dental practice will place dental sealants on children. So firstly, it would be pit and fissure sealants are especially useful in patients during the caries active period from ages 6 all the way up to the age of 15 years. They're indicated essentially in teeth with deep pits and fissures, as well as preferably in recently erupted teeth. When they talk about less than 4 years old, we're talking about those primary molars that we had discussed earlier. So those would be the ones, the moment they erupt, you then seal them, because we expect them to be in the oral cavity for quite an amount of time. Then from there, the sealants should then be used as part of a prevention program that includes, one, the use of fluorides, dietary considerations that we had discussed before as well. Speaking of dietary considerations, ladies and gentlemen, there are parents, or you will find parents, who are just like, their children are sugar addicts. So sometimes it's not practical to be like, don't give your child sugar anymore. It's either, one, reduce the number of or the amount of sugar that the child is consuming, or when they actually consume sweets or chocolates or whatever sugary foods that they have, encourage their parents to force their kids to drink water afterwards, just to get that flushing mechanism that we talked about earlier on. Plaque control by means of brushing, and encourage as well parents to actually be there to monitor how their kids are brushing their teeth in the morning as well as in the evening before they sleep, making use of soft, small toothbrushes, and then as well regular dental examinations. So either once a year if the child is like low caries risk, but definitely during the developmental stages, we would encourage parents to bring their kids in for dental checkups twice a year, so that we just make sure that we intercept any problems or address any problems as the child is growing, because the risk of caries increases with age. Yeah. And then contraindications to dental sealants are also very important, ladies and gentlemen. So in these instances, we would not make use of dental sealants. This would be then patients who present with like a lack of pit and fissures. In some instances, you'll find molars that appear as though they are flat tops coronally, so there would be no need to place dental sealants in such a patient. Any apparent occlusal decay, remember guys, these are just sealants, we're not restoring teeth. So if there is any occlusal as well as interproximal decay for that matter, you would rather go for a more durable material, be it an amalgam if it's severely carious, or just a composite restoration. That would then be used in such instances, not dental sealants. If there's insufficient eruption of a tooth, you actually have to wait for a tooth to erupt into the oral cavity before you decide to place dental sealants. Soon to be lost primary teeth. Like, it doesn't make sense, ladies and gentlemen, if like a child, I could say, is 6 years old and you want to put a dental sealant on their ears. It does not make sense, because from the ages of 6 to 7, the child actually starts losing those teeth. We expect the eruption of their first permanent molars. So why would you put a dental sealant on a tooth that you know is going to come out within 6 months or so? It does not make sense. So we won't perform dental sealants on such teeth. And then most importantly, poor patient cooperation in the chair. So if you guys as a dental team have tried every behavioral management technique under the sun and the patient is still not cooperating, do not perform this procedure, because if you cannot get to isolate that tooth properly, that sealant is not going to stick. So you're basically just losing material unnecessarily, you're losing money unnecessarily. So you'd rather just leave that child alone actually.